Are you ready? Should I start? Okay, I will start just now. Okay, so there are a few things that I want to touch. Ne? I'm sure most of you must have heard when Totalo was speaking about the inequalities that are happening within our society, especially in the health sector. Ne? So one of the main things that you should learn to understand is that unfortunately in our country, if you are poor, then you don't get a, a same quality service as those who are rich. It doesn't only happen in the health sector, it also does happen in other many sectors. I'm sure you might have seen or you might have heard people complaining this week about the justice system. So it's across the board. So the more you are rich, the more you are likely to have better services. But then now, as clinical associates, I understand that most of us we do understand the struggles and the lives of those who are poor better than any or better than most of the professions. So I want to tell you that when we started this profession, in fact, I was in the first group, as you might know. One of the main reasons for it was to give those who are poor and the others the better quality health service. You know, some of you might be from rural areas. In fact, most of you. You could have seen that more in the first semester. Now it have changed a bit, especially with the stipend coming into play and things that start changing. But seriously, I want you to think and remember the first time you went to a hospital or to a clinic, and think how long did it take you to be able to see a doctor? How long did it take you to be able to be seen and to get your service? And then just think now that you are here, if you could go to maybe to a private practice or to a private sector, how long will it take you? So there is a very big picture that shows that the more you are poor, the more you are likely to get poor health services. And this speaks to many things. Unfortunately, I won't be showing you today that picture, but one day I will show you when you reach those levels that it will be even more easier for you to understand those kind of pictures. But then what I want to say is that we as clinical associates come into play here to say, with our understanding of how our people have suffered, then we come to understand that the different ways of helping them. Let me tell you advantages of having this profession. And I was telling the public health students on Tuesday that our profession is different in many ways. And then one of the different ways that our profession is different with is that instead of us going to maybe to Sentin and taking people from there, young students from there who want to come and do this MP, and then say let them go over this course over 3 years, and then remember these people are from Sentin. They have been staying there for almost the rest of their lives. Now you take those people from Sentin and then you train them maybe for 3 years, and then they get their degrees, BCMP degrees, Bachelor of Clinical Medical Practice degrees, and then you expect those people to go and service the poor people. You expect those people to go and work in rural areas. Those people have never been there in rural areas. Those people have only seen the light, and some of us we only started seeing the light at night, maybe this year. So and then you expect a person who have always been seeing a light during the day and at night, and you expect them to go and work in rural areas. It doesn't happen. So that is why now, in one of the studies that we've done here at University of Pretoria, it has been shown that for clinical associates, most of them, I think about 57% of them, are most likely to go and work in rural areas than to go and work in urban areas. In fact, they prefer to go and work in rural areas than in urban areas. But then one of the other things that I also wanted to talk about, which is also very serious, and I've been very vocal about this. You know, Dr. Lowe spoke about the burden of diseases, different ones. And for me, I have a very big passion for HIV and AIDS, to say at some point we'll need to fight against it and we'll need to defeat it. So what are the few facts around it? So currently, and I heard this yesterday, last time I heard we were having about 6.3 million people HIV positive. But I heard yesterday that we're now having about 6.7 million people who are HIV positive. This is a very big problem in our country. So HIV and AIDS is one of the biggest challenges in the health system. Let me give you an example, and I want to make sure that you start thinking. So I'm sure most of you do remember Ebola. Eh? You do remember Ebola. How scared were you of Ebola? Very, very, very scared of Ebola. Ne? Most of us, in fact, even myself, I was very, very scared of Ebola. But let me tell you a story. You know, globally, Ebola over 2 years, over a period of 2 years, from 2014 to 2015, Ebola, that epidemic, it killed about 11,500 people. Over a period of 2 years, ne? 11,500 people, ne? Globally. Now, that is over 2 years and it's globally. Now, let us come back to South Africa, only in South Africa, and speak about HIV and AIDS. HIV and AIDS kills that same number of people, 11,500 people, South Africans only, not globally, but South Africans only. And then, those same number of people, 11,500 people, they die in less than 15 days. Remember what I said to you. I said Ebola killed 11,500 people globally, and it took 2 years for it to do that. So in South Africa, in 2010, in fact, the same number of people, they were dying in less than 15 days. What does that mean? It means that I think it was about 350,000 people who were dying of HIV and AIDS a year. And then 350,000. And then that comes down to about 700 people dying of HIV and AIDS. That was in 2010 stats. 700 people dying each and every day of HIV and AIDS. And if you go down, it's about 1 people dying in every 2 minutes. So now, if we say, yeah, maybe I have 10 minutes to speak, then it means that about 5 people would have died of HIV and AIDS related death. This shows you how serious HIV and AIDS is. Now, I also want to also stimulate your thinking. Let us think about maybe biggest crisis, or maybe let us say the massacres that you know that have happened in South Africa. Any one of you, do you know any of the massacre that happened in South Africa? Eh? Sharpeville massacre. So in Sharpeville massacre, we had about 69 people. In fact, it was 69 people dying. Ne? And even today, I think we're having a holiday on the 21st of March, ne? Just to remember those people who died on that day. 69 people died in one day. It was a once-off event that happened over one day. Ne? 69 people died. We have the whole day dedicated for that massacre. Ne? Let us also think another thing. June 16. How many people died on June 16? About 176 people died, ne? In June 16. But then we have a whole month dedicated to youth, just to remember what was happening in June 16. But then you also come, unfairly so, you come and you compare it to HIV and AIDS, where I say 700 people die on daily basis. From the 1st of January to the 31st of December, 700 people will be dying almost every day. What does that say to you? It means somehow we were underestimating the power of HIV and AIDS. And now, yes. Yes, I'm going there, and I'm going there. So now, and that is a very good observation, and that is where I'm going now. So we had an AIDS day. In fact, it's a World AIDS Day. It's on the 1st of December. A World AIDS Day, ne? And remember what I said initially. I said we have the whole month dedicated to young people. Ne? In remembering what happened in 1976, where 176 people died. And I'm not saying it is wrong, but I'm just saying we're not giving HIV and AIDS much attention that we should be giving it. And I want to challenge you today here to say maybe we also need to be part of what is happening in our country. And as we are having better understanding of the health system, maybe by the time we graduate, or even now, we start changing the world. So, what I want to say to you, as clinical assistants, we are not just there to go to a hospital or a clinic. Just go there, you sit, you see patients, and then you go, and then you're off. You have knocked off. I'm now going home. It doesn't work like that. So the moment you come to work with us here in the health system, you need to devote your life to say that for the duration of my life, I will be a clinician on duty or off duty. So how many of you posted about the youth month on Facebook? Most of you. Most of you would have said something about the youth month to say that we are remembering our people who died. And that is good. We are showing that you are part of the society. But now, look, we're having more than 700 people dying. And how many of you have said something about HIV and AIDS? I think we need to start thinking about those kind of things. And I'm just challenging you to start thinking on a different ways. Yes. Mm.
Are you saying that the world is changed from being just one day to being every day, whole year thing? Because December there are a lot of holidays
Yeah.
and Christmas,
Uh,
you know,
I,
December and stuff.
I can't. In fact, I don't have answers. But I'm just here to stimulate your thinking. I'm just here to ask: is it fair? Are we doing the right thing? And to me, I think that like we used to say, make a Mandela Day.
Make
Uh,
everybody like that.
yeah, yes, yes, yes. Make every day a Mandela Day. Something like that.
Make every day make
Something like that. Yeah, but as long as we are going to give an attention that is deserved by this HIV and AIDS epidemic. Yes.
Just a response to what you asked, because I know that you said that you tend to just like simulate
Yes. Yeah.
versus hormone. I get what you're saying when you say that, if you look at the comparison, we have a youth month and we have a World AIDS Day, but if you look at the comparison, the effect of AIDS on us, as opposed to us not being acknowledged as hopeful youth.
Yeah.
You can't exactly compare them because AIDS is in its own spectrum. So I think basically what you're trying to say, if I understand correctly,
Yes.
is that AIDS has been given a lot of attention. I mean, you talked throughout school, but it's not exactly being prioritized as high as it should be. And since it's worsening, maybe we should just put a little bit more focus not on celebrating those that have it, but more on fighting the struggle that we're dealing with as a whole.
Yes. Exactly my point. And I'll tell you why am I saying this? What just remembering? Yeah.
World AIDS Day is not celebrating all of the people who have
No, I just think
You're celebrating the people that are suffering, and you're showing that you're supporting them in their struggle, not necessarily saying,
yeah.
why is it remembering those that lost their lives because of remembering those that are struggling with it currently, and also trying to promote awareness to those that might have it.
Yes. Yeah. So now that's where I was going to now to say that as much as today it is a crisis that maybe we're having more than 6 million people who are HIV positive, but then the biggest problem now is okay. Already now we're having 6 million people, more than 6 million people, in fact 6.7 million people who are HIV positive. But going forward, we're still having more than 1,000 people getting infected almost each and every day. In fact, in a stat that was done, I think it's a stat 2013, it was showing that each and every day, 1,000 people get infected with HIV and AIDS. So now this shows you that then we're not winning. We're not winning the battle. So now we have a responsibility as young people to lead this. And I was talking on another show on Monday, saying that what happened, in last year in 2015, is that for the past maybe let me start here. For the past maybe 10 years, we've been having leaders saying that we need to have free education in our society. We need to make sure that tertiary education is free, and we've been saying that fees must not increase and all those kind of things. Leaders have been saying that in the past, but there was a difference between that and what happened last year. Last year we had young people leading that message to say, coming together to say that we must have fees falling. They were having a fees must fall campaign. So, and then you take that and you compare it to HIV and AIDS, and you say, for the past 10 years, we've been having leaders saying that we must make sure that HIV and AIDS does fall. But we haven't heard the voice of young people saying that HIV and AIDS must fall. So one of the things that I usually try and challenge people to say is that maybe let us have this energy of 1976, let us have the energy of this must fall and take it to HIV and AIDS and have young people leading that fight against HIV and AIDS and see what will happen in that fight. So now, and going away from the topic of HIV and AIDS, I think one of the other things that I want to touch in is that unfortunately, or maybe fortunately, when we come to a medical school, we usually come excited saying that we want to help people understand the frustrations of the people back home, or maybe understanding the frustrations of the South Africans as a whole. But unfortunately, by the time you finish your training, the level of thinking or maybe the way you do things change a little bit. You somehow lose the energy that you had when you started the profession. And we're open to suggestions. How can we deal away with the thing that even by the time we end or even by the time we qualify, we still have the same mentality that we need to go back and make sure that we change the face of the South African health system. And especially here with us as clinical associates, our main mission is to make sure that we improve the quality of life, we improve the quality of health system in our country. So I want to challenge you, maybe not to give me answers now, but maybe to go and think, what can you do to make sure that you don't lose that special thing that attached you to this profession in a way that without even looking at financial gains, you say, I want to go back, I want to go each and every day in the morning and work and make sure that I give each and every patient an attention that they deserve and help them in accordance with the level of training that I do have. And I see that already there's a hand maybe with suggestions. Yeah.
The thing is, you know, like trying to think about what you're saying, you might
Mm.
so that thing doesn't like improve you because you like image. There are a lot of things that you come across here.
Mm.
Yeah, so which means in that case we will need to do two things. Like the people who have like energy and we need also for this person becoming very energy to so these people who are responsible for teaching are the one people that have also need to play a certain role, not to decrease. Like where they shoot them, all those stuff.
Mm.
They just have.
And
I want one
yeah.
where somewhere decrease.
Mm.
People can
Mm.
like,
Yeah, and I do welcome that a suggestion, and I do think there's some truth in it. And like I said, I have no answers, but I'm just here to stimulate your thinking and make sure that you start thinking about these kind of things. And it is always good when we identify these kind of things so that we can deal away with them. To say that let us preserve, let us have the energy that we had when we came here. Now, let me speak a bit about the profession of clinical assistant, which I'm sure most of you here today you are you have passion, you are so passionate about it, which is a profession of clinical assistant, which I also do have a passion for it. So now, one of the main challenges that you will always go across is that everywhere you go, when you introduce yourself as a clinical assistant, majority of people will say, "But what is a clinical assistant? What is that? So what are you talking about?" And I want to say to you, unless we start embracing and celebrating our profession, and we start saying that we are so proud of this profession, and let me tell you, ne, I do have few of you here, maybe within a social space. Unfortunately, mostly in most times, and I'm also guilty of this, we don't talk about this profession in a social space, like maybe on your Facebook or on your Twitter account. We don't say anything about clinical associate. We don't say that we are clinical associate. I'm not sure if we're proud of this profession or we're ashamed of this profession. I'm not sure if we're proud of doing a Bachelor of Clinical Medical Practice or maybe we're not proud of it. Many, or maybe some, maybe have had ambitions of becoming doctors and maybe somehow they came to this profession. And I do understand that part because, yeah, we maybe most people wanted to be doctors. And if you wanted if you say, I want to be a clinical associate, but I don't want to be a doctor, I, I'm not sure how much truth will be in that statement. But now, the moment you're in this profession, maybe try to make sure that you advocate for it in many ways. For example, we always say that our minister doesn't talk about a clinical associate. We always say that maybe our MSCs leaders don't talk about the clinical associate profession. We always say that people don't know anything about our profession. But we are also guilty of not saying anything about this profession. We're also guilty of not bringing this profession into many of the conversations that are happening. So now, if you see a patient, ne, and you start a conversation with them and you finish that conversation without mentioning that you are a clinical associate, yet you expect them to know that there is a profession called clinical associate. We are being unfair to that particular patient because we are saying nothing to them about clinical associate. They call you a doctor, you say yes, and you continue. But yet tomorrow, you will be expecting them to know about this particular profession of clinical associate. Yes.
In reality, it's not as easy as you talking about it.
Mm.
But you go as a hospital, you don't have time to really explain to the patient that, no, I'm not a clinician, and then, clinical associate, I did when you are there, instruct or wearing a coat, having a stethoscope, you are a qualified clinician. You are as good as a doctor. You go there and then you help the patient. The patient, the only thing that they know in the hospital is doctor or sister. If they see you in a white coat,
They say doctor.
having a stethoscope, they immediately say, doctor, please help. This and this is happening. And that's how when the patient is giving, saying, doctor, please help, you are going to help. You're not going to say, no, I'm not a doctor. You immediately give that patient the help that she is calling out to you to do. And another thing, Ms. Costa once showed us a video about a certain movie asking what is a doctor. I would say my mother is a doctor, but she's a teacher in profession because she is able to be the primary health care at home. She can make me feel better. And anyone, whether you're a clinical associate or whatever in the hospital, if you are able to help heal, treat that person, take care of the patient, you are a doctor.
Okay, so you are saying nurses are doctors.
Yeah.
And
the video that I saw in this problem, it's just a title. A sister is a title. A doctor is a title. Clinician is a title. But everyone can be a doctor.
And I do agree. We just document to some extent. In a way that maybe at some point in time you will have to see maybe even 40 patients a day in one day, and just imagine if you'd have to keep on repeating and explaining that I'm a clinical associate, this is what a clinical associate is. But now, and I'm saying I'm here to stimulate your thinking. Let us say now, then we move with that pressure and we say, but we don't have time to tell our people that we are clinical associate. 10 years from now, maybe in 2025, do you think our people will know what clinical associates are?
In the time when you have that time to explain your profession or promote what you do it.
Okay, yeah.
You can do it on social networks. You can explain to your friends and people at home that you are a clinical associate, and not exactly in the hospital when you are working. It's not as easy.
Yes. Yes, yeah.
They know that if you have a home and you are a dog, so even if they are and providing to the other people, so I was trying to explain this.
Yes.
And the other next day, what do you think this means in relative capacity?
Yeah, yes.
I think it's also motivated. The patient is our problem growing. There are things that we don't know about our problem. We are here to work and we want to know how we evolve. And it's so difficult when you contact with a patient to say as simple as what I said is doing. Some of you can understand, but when you say everything, you still need to explain yourself. And when is that time to start explaining yourself? I think we need to do you know, this is very wide you can tell as a man. So maybe we can have a system, we can have our own version on the code, or we can have our own clinical assessment
and like I'm saying, we're open to many suggestions. And I do agree. Repeating the same thing that I'm making to everyone maybe might not be his way out of advertising this profession. But think, how much time will it take you to give your patient a pamphlet that is having information about a clinical associate? Will that take you a very long time? No, it won't.
No, but do we have those pamphlets?
Then the question is, that is a very good question. Now the question will be, if we really want to advertise our profession, should we then make pamphlets talking about our profession? There are many ways we can advertise it. Yes.
But I can also say,
Mm.
okay, yeah, let's
Uh.
but those who don't appreciate, you don't appreciate this topic. We like you saying when you explain to this and then but then that's not the way it is.
Yeah, and
I mean, like, why are you studying this? You wasting your time. They tell me I'm going to I'm going to do some other time, and then maybe this person can he said, what do you think about this?
that is a very good one, because some people now are still thinking that this profession is just a waste of time. Okay, guys, can we have one conversation? Okay, let me tell you a story before I take a question. You know what I learned in 2011 when, in fact, in 2012 when I went to practice in one of the hospitals at Tekwini, Austin Diswen, Hospital. So the moment I arrived there, I met a CEO of the hospital, and I told her that I'm a clinical associate from University of Pretoria. I came here to work. I was told that I'm supposed to come here and start working. And then he said, "Oh, you are a doctor." I said, "No, I'm not a doctor. I'm a clinical associate." But, "Oh, you mean you're a nurse?" I said, no, I'm not a nurse. I'm a clinical associate. So, are you talking about a staff nurse? No, I'm a clinical. Then I started explaining. But now, what I realized is that even if you can explain, maybe it will even take you 10 minutes to continue explaining. It's difficult for most people to understand. But what was the easiest way of showing them what is the clinical assessment? Working together with those doctors, working together with the nurses. And I can tell you today that in the first doctors meeting that we went to, in fact, we were two. It was, most people were saying, but why are they here? Why should they really be here? Should we really have this profession? But within a month that we were there, you could see that people start appreciating our profession. So the more you work with people, the more they are going to start appreciating your profession. Even with patients, the more they see clinical associate and knowing that they were seen by a clinical associate, they will start then seeing it different. They will start then appreciating our profession. And I do agree that there's still a very long way to go. But what I don't want us to do is to stand here again in 2025 and still complain about the same thing, that people still don't know anything about the profession. Yes. Uh,
I think the core problem comes from the condition. The people who were coming to school
no, I was a student. No, yeah. Yeah.
I don't think there was a lot of advertisement about it. Because when I was thinking about it, even now when you said when you go to Google and type in information, what's gonna pop up is the same applying like there's not a lot of information. I struggle to find information. So why would I apply for a profession that I don't know?
Yes. Yeah, and that is a very good one.
When I was saying, I wasn't saying it all, but the fact is that majority is 10% of the population. I'm not saying it's a bad thing. I was just saying we should find a way that we should appreciate it. If 10% appreciate that appreciate, but then it doesn't happen. Because if you speak to like those who are in 30 years and those who are waking, they'll tell you, the other one will be so frustrated saying, I'm so tired that this is what people are doing. I'm not supposed to, what am I supposed to get from them? What am I getting from them? Yes, some does appreciate them, but if we don't talk them, still continue with it, then what are we doing? Where are we going? That's what I want to do.
You can answer then I'll answer.
Yes. Okay, let's hear.
What I agree with what the main fact is that if anyone asks you what you are and what you do, you don't have time to train yourself. You are still a part of a medical team. And that's the shortest definition you can say, like you work with all the other medical staff. So, like we said, and if you have the time to explain it, and like Phil said, like you have to start by promoting it, but I think the best way is through the service you give as well, and not just handing out and saying it like pamphlets or anything, but like show what you do.
Yes.
The best way
Yeah.
of promoting.
Like I was saying, for me, like it took us a month to convince almost everyone in the hospital where we were working that we really need this profession. Yes.
It's okay to work if you work in a but then you also touch it for your health. If you're not satisfied, you're not happy, you're not appreciated. I personally don't think that what you do it's not healthy for you. It's just not it.
Yeah. Let me just tell you a story. You know on what was it, on Tuesday or on Monday there was a discussion on radio, ne? On radio 702 about something else. It was including doctors, ne? But then we had a doctor who then called and then was asking about the scope of practice for clinical associate. Because this doctor was excited about this profession, but he felt that this scope of practice is pulling back our profession. So those we still have doctors who are so passionate about this profession. And now what we must think is what makes them to appreciate this profession. Majority of them they have had an experience of working together with clinical officers. And then the more they work together with clinical officers, the more they get to appreciate this profession.
Yeah, another thing I was going to say is don't strike too much or focus too much on being appreciated by your staff member. Try to be appreciated by your patients. Help them. Don't look at what another person is saying about you. Look at what your service is saying about you.
This conversation is very good. Shall we continue?
No, last time.
Let's give Kimberly one word and you one word, then the last two, and then I'll summarize.
Everybody's opinions, just to follow up, everybody said there's nobody that said anything wrong. Yes, it is frustrating to have to explain yourself. Yes, it is, it is important to, deal with these things in our own time, but at the same time, you've got to take into account we're still a very new course. Not everybody is